You're about to see a video of the staff and team of the PHO and the work that we do for you. The mission and goals of the PHO are to improve the healthcare through the collaboration and integration of hospitals and physicians. The staff, or team as we like to say, of the PHO, our job is to help you accomplish that mission. In today's world, we talk about the triple aim: better care, more cost-effective, and good outcomes for patients. That's the goal of the PHO and the community physicians of Maine.
My name is Ginger Johnson, and I am the receptionist and scheduler at the PHO. It's a busy place, it's a great place to work, and I hope I've always been helpful when you call.
That's a good question. With the clinic itself, when I think about the PHO, it basically, if you utilize the resources that are there, it affects almost every part of what we do. We have a practice coach who helps us with our team meetings and how to run efficient team meetings, but also how to run efficient teams for some of our projects. We have our data specialists who help us look at some of our office flow and use the data that's in the CIR. I have the connection to the CIR specialist if I have any questions about the data or how to input information. And we have a care manager who helps us manage our most complex patients.
Well, a care manager is a nurse who has the ability to go into patients' homes of the practice, go into the homes of the patients of the practice that she's assigned to or he is assigned to. My job is to assist patients' families in setting their personal health goals.
She has access to the electronic medical record, so her reports from the home visits are probably the most accurate reports we have in that chart.
It's very humbling to go into a person's home and to be allowed into a person's home. And I can build some very worthwhile relationships with patients. It gives me an opportunity to build trust, and that's humbling when someone trusts me enough to come into their home. I love that.
Care transitions is basically following a patient through the transition process from hospital to home, or sometimes hospital to rehab to home. And what I do is meet the patient in the hospital, follow them while they're here. When they're discharged, if they go home, I'll give a follow-up call and set up a time to make a home visit.
So the CIR is a product that can help paper-based or EHR-based providers manage their populations. I help support anything related to the CIR, so any questions or concerns that providers may have when they're going to document in the CIR, or any of the quality reporting that the CIR offers our providers, things like NCQA and PQRS. I help support that as well. One thing that's wonderful about the PHO and the CIR is that it can be a constant for the moment. So while all of these things are changing in the environment, the CIR is a product that has been tried and true for years, and it's something that providers can continue to document into and use as a resource to help see them through some of these changes.
In my current position as the practice administrator, we use the PHO for a number of things as a big resource for our practice managers and for our physician groups. We have had folks come up and do some educational sessions with us around meeting skills, communication workshops, which have been really helpful. We also are involved with the Clinical Improvement Registry, and that's been a huge benefit because prior to using the registry, we had to do that through claims data, so that was a lot of extra work on our billing staff. So being able to use that information has been helpful.
I handle all of calls from the provider community, soup to nuts. If they're looking for payer information, credentialing information, what's going on in the community as far as Medicare, anything that has to do with their office working, they can call us. When a practice manager calls me and is not getting their claims paid by one of the payers, Anthem, Harvard, Aetna, I step in and act as a liaison for that practice. I attend meetings with them if they're not getting their claims paid.
Some of the other benefits that I feel like is offered through the MMC PHO are the office manager forums. They come to Western Maine quarterly, I believe, and it gives the practice managers and our administrative staff an opportunity. At those meetings, some of the representatives from the major healthcare plans are available to us. So we have an opportunity to ask questions of them and really just have one-on-one dialogue. They provide us with the most recent updates that is really relevant to our practices.
There's a Pathways to Excellence program that has a website that rates physicians on different clinical quality programs. And then there's national recognition programs like NCQA and Bridges to Excellence. I also provide them with resources in regard to any external quality initiatives. So what we do is we research all the programs. We're kind of the liaison between the payers and the Pathways to Excellence program, and we make sure there's all the details available to them.
Their support in applying for NCQA recognition in diabetes and cardiovascular care made the process so much easier because it took an environment that could have been hand data collection to information that had been managed through the CIR, and they actually rolled it out with our application. We just did the application process. They sent the data to NCQA and supported us all along the way for that recognition, and it was a huge benefit for us.
The Behavioral Healthcare Program is a managed behavioral health care company, and we are hired by employers to manage the behavioral health benefits of their employees. And we manage inpatient benefits, partial hospital benefits, and outpatient benefits. So we have over 1,700 providers in Maine, New Hampshire, Vermont, and upstate New York, and we also have over 100 facility providers who work with us closely. Even though we've grown tremendously over the past few years, we are still a small company.
I think what I really like about the PHO is that they're local, and so the people that are reviewing your care are people that you know. And I guess I always feel like the PHO is reasonable in negotiating around getting authorization for care. Marty's my go-to person where I can always rely on Marty to pick up the phone and be happy and friendly and help me to, if there's any problems with paperwork for him. He's been very helpful in helping me get that, making sure that that's submitted.
We are practice improvement advisors, and as practice improvement advisors, we work closely with providers and practices to help them change the way they work, to improve office efficiency, to improve outcomes, to help with workflow designs, and we do that in a variety of ways.
We also sometimes work with leaders to help them adjust their thinking to really be able to empower their frontline teams to make decisions and to test out changes that they may have ideas about.
So we've seen, especially among the office staff workers, is a sense of empowerment and a sense of ability to better care for the patients, which has made their world considerably better. It's been just a really, really heartwarming experience.
People that never mentioned or never said anything before about what to do and what their ideas were. And they're the ones that are doing it. I think we as a group owe our ability to move forward in providing the best care we can for our patients, our women, and keeping on the cutting edge, the beginning of all these changes and up with them. That's a result of what has happened through you guys teaching us how to interact with each other. The way that we communicate is so much more progressive and right on target for helping us move ahead in what the changes that are occurring in medicine. Well, you got to understand that I'm the oldest guy in the group, and I'm the one who doesn't like change. That's about That's about being old. I've done it this way for years. Why not keep doing it? It works. Wrong doesn't work as well as what you taught us. We are a testimonial to what you are teaching us.
By now you've heard from a lot of our team members, a lot of the practices that they have worked with, and a number of physicians that have been served by our team. I'd like to take the opportunity to say that our team is just wonderful to work with. They're full of passion, they're very skilled at what they do, they enjoy collaboration, and there's a lot of fun-loving activity going on here as well. We know that healthcare is changing tremendously and rapidly, and our entire team does its best to keep up with the healthcare changes and bring those changes into service to you so you can deliver better care for all the patients in southern western Maine.
Waterboro to western Maine.
Damascotta, Booth Bay,
Portland,
Spring Harbor,
Saco,
Biddeford,
Saco Biddeford,
Belfast,
Falmouth,
Norway practices,
Westbrook,
Rockport,
Mid-Coast Hospital,
Damascotta,
Norway,
Portland, South Portland, Scarborough,
Standish,
Portland,
Southern Maine Medical Center,
Limerick,
Brunswick,
Leamington, Baldwin, Wiscasset, Yarmouth, all over the place. Right. Wherever our patients are, we'll go.
we work for you. And we work for you.
we work for you.